the symptoms which are associated with venous insufficiency, or the discomfort caused or the symptoms caused by venous disease, are the following. I've noticed that probably one of the strongest indicators that one has venous disease is night cramps. And I would have, if you asked me that 20 years ago, I would have never, that wouldn't be the first thing which would come to my mind. But a lot of patients with venous disease, with venous insufficiency, get night cramps. And when I treat these patients, the first thing which seems to go away is the night cramps. I think it's very important for patients to know, if you have night cramps, I would definitely ask your doctor if you could have venous insufficiency. Now, the other symptoms, of course, are the heavy, tired feeling. You know, we all get tired at the end of the day, the leg hurts. We think it's just normal. It's a normal way of living, working hard, but not necessarily. You don't have to hurt in your legs just because you're above a certain age. Sometimes it is caused by venous insufficiency. And one of the ways of finding out, if you put your leg up, pain goes away, the chances are you do have venous insufficiency. If you wear compression stockings and the discomfort goes away, the chances are very good that you have venous insufficiency. If you have burning or heavy, tired feeling, burning sensation where your varicose veins or your spiders are, or you feel a little bulge where you're hurting, the chances are, again, your problem is caused by venous insufficiency. Occasionally we have patients who have some inflammation in the skin. It's almost like a rash, especially on the inside of the lower leg, around the ankle. They are most likely associated with venous insufficiency. And I have a lot of patients who come and see me from either a dermatologist's office, or they have tried hydrocortisone cream and all kinds of things trying to get rid of this, not knowing that they're actually caused by venous insufficiency. We call that venous dermatitis. Dermatitis means inflammation of the skin, and venous, of course, means veins. Hyperpigmentation. Hyperpigmentation, hyper means increase level of pigment. Patients who have dark coloration of the lower leg are usually, again, caused by venous insufficiency. What happens is the pressure inside the veins are so high that red cells literally ooze out of the vein. And when the red cells gets outside the vein into the tissue, it's like a fish out of water. The red cells die. And what gives the red cells their color, what hemoglobin gets its color from, is iron. So when the hemoglobin molecules break down, you get iron deposit in the lower legs, and the skin looks very dark. So it is almost like somebody getting a needle and injecting iron into your leg, having a tattoo in your leg. So if you see somebody with dark coloration of the lower leg, it's most likely caused by venous insufficiency. And of course, if you're pouring iron into the skin, into the tissue of your leg, lower leg, it causes scarring. So the skin is not only dark in coloration, but also thickened, like a leathery appearance. Most people, when I mention that, they say, "Doc, I remember my mom had it, my grandmother had it, my uncle had it, but I'm glad I don't have it because I just have varicose veins." And my argument is, the chances are that your mom, your grandma, your uncle, when they were your age, all they had was varicose veins. Now that they're older, gradually the condition has become chronic, and now they are in the shape that they are. So it is very much advisable to, I believe, know if you have venous insufficiency, and if you have venous insufficiency, try to take care of it earlier than later. Fortunately, it is reversible. I've noticed when I treat these patients, the condition gets better. But the worse that it is, the longer it gets for it to get better. So the sooner you seek treatment, the better off you are. Another condition which I was actually surprised to see happen so commonly in patients with venous insufficiency is restless leg syndrome. In one study I read almost 10 years ago, they had found that 75% of patients with restless leg syndrome and venous insufficiency, when they had their venous insufficiency treated, the restless leg syndrome went away. And 75% cure or improvement is very significant. It is more than luck. I remember one of my patients told me that, thank you, doc, and now I can go to bed with my wife because I've been sleeping on a couch for all these several years now because of my restless leg syndrome. I was keeping her awake at night. So if you have restless leg syndrome, think about venous insufficiency. Another symptom of venous insufficiency is leg swelling. Now, there are all kinds of reasons for leg swelling: too much salt, heart failure, kidney failure, pregnancy, etc., etc. But the swelling that one gets associated with venous disease is usually what we call non-petting edema. And don't worry about the terminology. Basically, what it means, if you put your finger and push on your ankles and you leave indentation, that's a petting edema. The chances are that's not related to venous disease. But if you cause non-petting edema, then it is most likely related to venous insufficiency. And why is that important? It's important because a lot of people, because they don't see the indentation, because they don't see the marking of their stocking on their ankle, they feel they don't have leg swelling. They think that just their leg is becoming that way. Over time, it's not true. When you have venous insufficiency, the leg almost becomes like a pillar, like an elephant. You know, it's just straight cylindrical as opposed to have shape. I'm really surprised how the leg swells up in these patients with venous insufficiency. And when you treat them, the swelling goes down. In fact, one of my nurses, after I treated his leg, it took him about a year, but he actually went to one shoe size. The shoe size is smaller. Which I would have never thought that would make such a big difference, but it certainly did, and I've seen it in my own eyes. And I definitely wouldn't recommend coming for a vein consult just because you don't like the size of your feet. But if you have venous insufficiency and you have your veins treated, the chances are, if you have swelling, the swelling will go down, and you might be able to get into smaller shoes. One of the questions that patients ask me about venous disease: okay, doc, the vein is not working, the valves are not working, why couldn't you repair them? They have been tried, and unfortunately there has not been much success in this field. I've been lucky in that when I was in upstate New York doing part of my residency program in Albany, they were repairing quite a few of these valves in the veins, trying to get them back to the normal. Unfortunately, the blood flows very slowly in a vein, unlike an artery. So as soon as you open a vein and repair them, because of the low flow, the vein clots. And when a vein clots, there's a risk of the clot moving, getting into the heart and lung, and potentially kill patients. So repairing of the veins at this stage has not been successful. Where we stand now in the year 2012, the treatment for a vein which is not functioning, a vein which has got bad valves, is either to strip it or to destroy it with a laser or a radio frequency. And we utilize laser in my office.